Welcome today to our panelists and the participants online for our conversation about caring for your mind and body through cancer. My name is Dr. Cheyenne Corbett, and I'm the director of the Supportive Care and Survivorship Center here at the Duke Cancer Institute. Today's webinar is part of a series of events in honor of Survivorship Month, where we will discuss topics relevant to you and share the resources our team has available for you. As we start our discussion, panelists, I think about how a cancer diagnosis and treatment can be very challenging to go through, how it can have an impact on your body, your sense of self, your life, and your relationships. In addition to the excellent medical care available to diagnose and treat cancer, there is also a broader care available to help support patients and their loved ones for this ripple effect into their lives. We have a group of experts here on my team at Duke who conduct research to advance the science of how we care for those emotional, physical, relational, and practical changes or challenges people face during treatment and in survivorship. And our team, in addition to conducting this research, also takes our learnings and implements those into our clinical programs. Today, we have several members of our team here to share their expertise on different topics, such as mindfulness, nutrition, physical fitness, sexual health, relationships, and parenting, in order to help share tools to support all of you on this call. As you have questions during our conversation, please type them into the Q&A feature. We have someone monitoring those, and I will weave them into our discussion today. And then we'll have time towards the end of the webinar to discuss remaining questions that you have. So I'd like to start with a question for a few of our panelists. Dr. Zach Talley, let's start with you. Could you please introduce yourself and share a bit about your area of expertise?
Yes, my name is Dr. Zach Talley. I am a board certified oncology clinical specialist and a certified lymphedema therapist. And I've been working at the Duke Cancer Center for the last 8 years.
Thanks, Zach. I think about after cancer treatment, many people think about sort of expecting to, quote, bounce back, or some people might say, quote, return to normal. But that's often not the reality of what people experience. Along those lines, what's one thing you wish every survivor understood about recovery post-cancer treatment?
Yeah, it's a really good question. I think the one thing that comes to mind that I feel like across the board folks should be aware of is really the reality that while time can be our best friend in allowing us to recover from either physical ailments, whether it's mobility, strength issues, or fatigue, time can be very helpful, but there are things that we can do today, whether it's before treatment or even during treatment, that can make a pretty significant difference on your overall trajectory and recovery. And I think a big piece of that is really building your team now. And I think that's a great, while we have some great panelists here that just kind of highlight all the resources on that team.
Thanks. And we have Keegan Zavondik with us today. Can you introduce yourself and about your role here too?
Yeah, hi everybody. My name is Keegan. I'm a registered dietitian here at the Cancer Center. I really love it. I'm very thankful to be here. I'm very passionate about nutrition.
Thank you. And so same question to you. When people think of that as like expecting things to quote return to normal, what are your thoughts about that in terms of what you hope people understand about their recovery as it relates to nutrition and diet post-cancer treatment?
Yeah, I think it's really interesting because I feel like a lot of people are expecting to kind of, like you said, bounce back. But, you just went through some major surgeries, some major treatments, and you kind of have to give your body some grace. It's healing. Things have changed. How you process nutrition, how you eat nutrition, it's changed, and that's okay. We can take some time. Like Zach said, we have time. It's your friend.
Yeah, that's important to remember for sure. We also have Felicia Harris joining us today. Felicia, could you share a little bit about your role, and also address that same question?
Yeah, good afternoon, everyone. I'm Felicia Harris, a medical family therapist, a licensed marriage and family therapist, and I provide services both inpatient and virtual at our Duke Women's Cancer Center for breast and GYN oncology. Um, The biggest thing that I would like for patients to know is to really take your time in the healing process, that recovery isn't linear. And so your experience also looks different from everyone else. And really giving yourself grace, like our other panelists have mentioned, in the process of healing, especially that mental and emotional health.
Thank you, Felicia.
You're welcome.
This fits right into one of our other panelists, Dr. Hannah Fisher. I'll ask a similar question to you in a moment after you introduce yourself, but about this sense of time, right? And the feeling of like going through cancer treatment feels like it's taking a long time and that the sort of rush to quote get back to normal or not. But the panelists have already talked about the importance of time and taking time. Can you introduce yourself and your role, and talk to us a little bit about your experience with mindfulness? And
Sure, absolutely. Happy to be here. My name's Hannah Fisher. I'm a licensed clinical health psychologist. Most of my research activities and my clinical work here at the Duke Cancer Center focus on behavioral strategies to cope with symptoms. That could be physical symptoms like fatigue, pain, sleep problems, or emotional symptoms like stress, anxiety, fear of recurrence, you name it. And one of my key strategies that I often go to is mindfulness. I find this to be a really multi-purpose tool. And I think especially for coping with this urge to move time along, get to the end of treatment, get to feeling normal again. Mindfulness is a really nice way to try to remain in the present moment. I know that can be hard and maybe a bit uncomfortable at times, because you might wish more than anything to be in a different space of life. But with mindfulness, one of the key principles of this approach is patience. And I know you all probably know what patience is. You could define it. It's hard to live by that value every day. Though still, it's key. If we can approach each moment from an unhurried perspective, how might that open us up to savor the moment more, savor the space that we're in, the good and the bad of it? Often sort of relinquishing that struggle against what you're dealing with in that current moment, that urge to try to make something different can feel like a big relief if instead we can remain present and patient in the moment.
thank you. I think I've heard over the years, oftentimes people being familiar with a psychologist and what they do in the sense of more traditional therapy, and maybe not as familiar with how some of these behavioral interventions can help with things like pain or fatigue or sleep, like you mentioned, or even cognitive changes. Um, that mind-body connection is really important. Can you help share sort of a definition of mindfulness that what does that actually mean in terms of what people are doing and how that may be able to help things like their stress level or like pain or things that they may be experiencing?
Sure. It's a good question. People have likely heard a lot about mindfulness. It's something that we see in the news, on social media. You might hear a little bit about it on podcasts. For me, really simply put, mindfulness is paying attention to what is going on in the present moment. So, not the future, not the past, but instead right now in this very moment. So, that is your thoughts, your worries, your anxieties, your emotions, good and bad, physical sensations like pain, fatigue, nausea, even sounds in your environment. Mindfulness is really just anchoring yourself to the present moment and paying attention to what is going on. And your second question, how can it help? This is one I get a lot. I like to think about mindfulness as a way to get out of autopilot. So often we move through life quickly without much present moment awareness. We're busy, we're distracted, we're often multitasking. And this means that when something happens, an event occurs, our tendency is to react really quickly. So there is an event and there is a reaction. Mindfulness can offer space between those two things. It lends us a moment to pause, to check in with our mind and our body, essentially gathering data, assessing how we are thinking and feeling. Is this fatigue that I'm experiencing? Am I angry? Am I sad? Am I anxious? Maybe I feel happy. Maybe I'm optimistic. This is all good data. And in that mindful space, we can take in that input and ultimately make a more informed and helping coping response. A coping response that is unhurried and patient and intentional. One other thing I'll say is often engaging in mindfulness meditation is really quite relaxing, both mentally and physiologically. It doesn't have to be, and actually that's not always the goal of mindfulness. But what I hear from most folks is by just sitting and taking a moment to pause, one can really calm the mind and reduce the intensity of physical symptoms. It might not eliminate them, and get rid of them completely. But it's a really powerful way to dial down the intensity and shift our perception, our relationship with those symptoms.
And Hannah, this isn't just something that sort of that there's a lot of research behind what you're saying there in terms of that impact. Can you share a little bit about that as well?
Absolutely. Yeah, this is an evidence-based strategy. There are many clinical guidelines that have come out from regulatory bodies in the oncology space recommending mindfulness-based approaches for dealing with physical and emotional symptoms. So truly, this is a gold standard approach. And one that I firsthand have seen patients experience a lot of benefit from in my own clinical work. Interestingly, if you allow me to just go on a bit of a history lesson for a moment. So mindfulness comes from Buddhist roots, actually, but sort of the godfather of mindfulness practice in more of a non-religious sense is John Kabat-Zinn. And he was a physician up in Massachusetts. So he really took mindfulness and has sort of made it into a really empirically based secular practice used in the medical space.
Thank you. That's really helpful. One way that I've also found it helpful to think about it or to talk about it is, as you know, I think of the work that Zach does, and just as people may need to work to build muscle strength or agility, and you might be starting from one place and building that skill or that strength. I think of mindfulness in a similar way, almost like maybe muscles for emotions or coping, etc., and that it takes some practice and you get better and stronger as you learn these techniques and then also practice using them in your real life setting. What do you think about that?
Yeah, you hit the nail on the head. I don't have much more to add. You're truly correct in that it's a skill, like riding a bike, learning to play a new instrument. It's a muscle that we can strengthen. Really, practice is going to be your best friend here. I often encourage my patients to think about mindfulness not as something you do, like a to-do list item, but rather something you be. And actually, I often say you are being mindful to really emphasize the ongoing process of it. It's an ongoing practice that each and every one of us wake up and choose to engage in each day. So, if you're curious about this approach and interested in learning more, I know often it can feel a bit overwhelming to sort of find where to start. I will encourage you to start with what you already have, and that's your five senses. So tuning into all five of your senses at any given moment is mindfulness. So you are paying attention to what you're seeing, what you're feeling, what you hear, smell, and taste. You can try this with very simple everyday activities like eating, walking, light exercise, or body movement. Maybe you sit for just 5 minutes. You can put a timer on your phone and simply pay attention. Pay attention to your breath, your body, the sounds in your environment. You're going to want to practice acceptance of whatever is present for you, even if it might be a bit uncomfortable. You might be experiencing pain, tension, nausea. Encourage you to open the door to all those sensations. Let them be as they are without fighting them or trying to get rid of them. Again, you might find a lot of relief from just releasing that struggle. There are a lot of mindfulness meditation recordings available on YouTube and through smartphone apps like the Calm. And then I'll make a plug. So the Duke Cancer Center offers a twice monthly mind body support group on the first and third Tuesday of the month. This is led by me, and we practice mindfulness. So we come together and engage in mindfulness meditation. We discuss our practice together, and it's really a welcoming and beneficial group.
Thanks for sharing that, Hannah. Yes, it's a wonderful group and a great resource for people. I want to touch just really briefly for a moment. We talked a lot about during treatment. There's also sort of the after treatment during survivorship, things like fear of recurrence or uncertainty. Can you share, is mindfulness something that can also extend to those types of thoughts or experiences in the survivorship phase?
Yes, yes, absolutely. Mindfulness can be used anytime, anywhere. So whether you are at the beginning and going through diagnosis and figuring out with your doctor your treatment plan, whether you are in the midst of active treatment or if you're in survivorship and now undergoing surveillance scans. Many of you probably know the term scanxiety. Many of you probably feel it. It is really uncomfortable to approach these really important milestones in these scans and to feel worried, right, about what the outcome will be. Mindfulness can be your friend here, again, because it can simply be relaxing, calming, reduce chatter in your mind, reduce physical tension or body sensations you might be experiencing, and also just to give you space to sit with it and to see, if I just sit with this feeling, might that be easier than fighting it and really, striving to get rid of it.
Right. I really appreciate that. And Keegan, it makes me think about a lot of the work that you do with patients as a registered dietitian working in oncology. I imagine you get so many questions because a lot of information is shared with people during treatment, or people are looking for information online, for instance, or other resources, and it's almost can be almost too much information, and them sort of we like working through what makes sense for them because everybody's treatment is a little different, their lives are a little bit different. Um, what are what are some of your core recommendations that you have for people who are going through treatment and into survivorship as it relates to nutrition and their diet?
Yeah, a question that I get very commonly when I'm talking to patients is what can and can I not eat? And I just want to like stop that because food is amazing, right? Food is family, sitting around the table, enjoying Tutu's recipe, right? Going out to lunch, sitting with your friend, eating in the sun, right? Those are great things. It's also culture, right? We're sitting there, we're eating different cooking methods, right? We see also like different recipes that are passed down from generations, so that kind of connects the two. We also see different spices and flavorings that really just like, excite food, and food should be that, right? I really just want to simplify the conversation around food. It's not busy. It doesn't need to be busy. Yes, it fuels our body. Yes, it connects us. Yes, it's family oriented. And those are the things that I really want to emphasize, right? And it's really interesting as, we kind of talk about science and like in the oncology setting, we see a lot of literature and a lot of discussion around a plant-based and a Mediterranean diet.
Mhm.
And there's several reasons why we are seeing kind of both. I really want to kind of emphasize and talk about a Mediterranean diet right now. With that being said, right, there's very unique interests on why a Mediterranean diet is kind of the recommended. It's really based on how we break a plate and build a plate up with this, right? So starting off, we see that there is kind of a prioritization of consuming proteins, right? It's almost like a tier as a triangle. We start at that bottom level, and it's really those are like everyday protein consumptions, and we see very frequently throughout meals. And that's both plant-based proteins and then our seafoods, right? So plant-based proteins are our legumes, like, chickpeas, quinoa, nuts, seeds. We also see a lot of consumption of soy products, tofu, beans. And then in the seafood area, we see a lot of consumption of that very fatty fishes like salmon, but also our white fishes like cod, tilapia. These are all kind of, like I said, the most common consumed proteins. And then when we move into that second tier, right, these are our infrequent, our moderate consuming, and these are our lean proteins. We have a lot of consumption of white meats. So that is our turkeys, that is our chickens, and we see that. And the reason we prioritize that secondary is because, yes, it's a lot of protein. We get full, complete proteins in animal products, but they're also very lean. And I want to emphasize that lean because when we look at the dairy products or the animal byproducts in this second tier, this is where we see a lot of those yogurts. I'm pretty sure everybody's familiar with Greek yogurt, right? And so that's what we know. We know Greek yogurt is a lower fat, high protein option. We see a lot of cheeses, a lot of creams, things that are low fat options. And I'll touch on fats in a second, but that's kind of that second tier. And then when we move into the third tier, this tertiary tier is really the infrequent consumption, right? And I want to kind of highlight that this is a little bit different than typical American diets. We see right here in this third tier, really that's when we see a lot of the consumption of our red meats, right? Our porks, our beefs. So that tier is really something that we see as super beneficial. And then when I move into the fats and kind of that conversations and the fats, I'm pretty sure everybody's familiar with the olive oils, the avocado oils, and that's what we see, right? We see lots of prioritizations of cooking with it, but we also see those integrated into the meals. We see lots of like avocados and big leafy salads. We see olives and cheese and crackers as snacks and nuts, right? And really prioritizing first the olives, avocados, the nuts are great. And then that second tier, kind of highlighting back to the proteins, right? That's where we see kind of the consumption of a low fat option and the lower consumption of those red meats because those typically do have a little bit more animal fat. And decreasing that animal fat and that and increasing our plant-based protein has been statistically proven to kind of, be a little bit more beneficial for our heart, and all other things that come into this kind of oncology space. And then the last thing I really want to highlight about building a plate and about this Mediterranean diet is carbohydrates, right? With carbohydrates, I'm pretty sure all these people know about carbohydrates. There's so much conversations around carbohydrates in this oncology space, which is amazing. But I really want to break it down and let you know it is okay to consume carbohydrates. Carbohydrates are great for you. They feed our healthy soul. Our brain needs it. It's the perfect key for our brain, right? And in this Mediterranean diet, we really see the increase of diversity of plants in the carbohydrate space. So we see lots of prioritization of vegetables, right, throughout the day, many intakes of that. We see lots of fruits throughout the day and snacking on that. As well, we see lots of consumption around whole grains. So prioritizing brown rice, prioritizing quinoa, couscous, all those fun things. And the reason that I really want to highlight on this is because increased intake of plant diversity throughout the day increases antioxidant consumption, which is great for fighting systematic inflammation. We see increased intake of vitamins and minerals that are super beneficial for daily cellular function, as well as we see increased intake of fiber. If you take anything from my conversation right now, I really want you to think fiber, fiber, fiber. I hope you never get tired of hearing this word because this is my favorite thing to talk about. But fiber is so important because it does a lot of things in our body, right? So when we eat fiber, it increases satiety, which means it keeps us fuller longer. And that's really good for one, helping regulating food so we don't see a lot of overconsumption of food, which helps with regulating weight status, which is something that a lot of people struggle during after kind of the treatment stage and then this oncology space. So that's super beneficial. It's also amazing because by it keeping us fuller longer, we see that it delays gastric emptying. So that means that the food in the stomach slows down into going to the intestinal tract. That is good for two reasons. One, it's really good for managing blood glucose levels. So people that have diabetes, that are pre-diabetic, this is really good for helping managing that, kind of taking a little bit extra stress off that. And in addition, it's really good for regulating bowel movements, right? I know kind of when you're going through treatments, after treatments, it's a little wonky and nobody really likes to be trained to that porcelain throne. I get it. So this is a very good natural way to kind of increase the consumption. And really, I just want to highlight that.
That's amazing. And you have quite an ability to take something that is a very complex, lots of information, lots of misinformation, and really make it easy to understand. Um, do the dietitians, I mean, I think it's so helpful for people to have a conversation like this because, as you said, food is very personal. There's also a lot of dynamics around food in
Mhm.
families and in cultures. Is this something that you sit down with patients and you discuss sort of personally their situation and their questions and make recommendations to them?
Yeah. So that's like one thing I really love because, nutrition is unique. I like to say in this oncology space, how uniquely created we are is very exploited and emphasized, right? What works for you may not work for the next person and the next person. So I really like to sit and kind of learn you. It takes a couple sessions, but I really just want to feel you out. I want to know what you prioritize, what you love. Like I said, I don't want to take anything out. Call me Santa. I love a cookie, right? And it's okay. You should enjoy the food in front of you. And we
Hmm.
sit there. I can talk. I work very closely, like with the pharmacist, so people that are taking different medications. We can kind of talk about, common deficiencies we see and how to correct that. Different things that you really want to increase, you want to take out, whatever you want to do. I work along with the providers, really, to just kind of tailorize and make nutrition less challenging.
That's wonderful. Thank you so much. And for your passion. I think it's really helpful for people to hear that and then feel comfortable
Hmm.
talking to you and raising questions.
Heck yeah.
Um, and I really appreciate the work that you do.
Yeah.
Zach, I'd like to chat with you now a little bit about physical activity and exercise. I think it's another topic that, of course, people hear a lot about, especially and then, through their visits with their providers or on the latest news headlines. And I think there's a lot of sort of expectations potentially about exercise and physical activity, and but what that actually means for people. What does that actually mean from your standpoint, in terms of misconceptions about physical activity during cancer and survivorship, but also like how do you want people to think about physical activity?
Hmm. I think when I think about exercise, there's a lot of misconceptions, there's a lot of myths. Many folks may have a bad history with that, whether it's from a childhood PE class or even related to just body image and just the natural struggles that many of us navigate throughout life. When I personally think of physical activity, I think of meaningful movement, whatever that means for you. For some folks, and this could be more stereotypical, it could involve going to the gym and lifting weights or getting on the treadmill. For others, it may be walking around your house while you're talking on the phone with a friend. I think there's a huge continuum of what that could look like. I think oftentimes when we think about exercise, we tend to be kind of constrained between two extremes. One is the all or none thinking, where it's really the no pain, no gain. I gotta push as hard as I can. And then on the other side of that, you have the I'm just going to worry about this once all this is over with. Once all my
Hmm.
appointments settle down, then I
Hmm.
can talk about this aspect. I think the all or none, really it's self-limiting and it's not sustainable, particularly as treatments may change and your tolerance for activity may change. And on the other side, the latter approach tends to delay the benefits that you could see before treatment or even during treatment. And we know that our physical function or our capacity for movement is a direct correlate to how we can tolerate treatments as we go through the process. And so I think starting now with where you are is really the biggest and most encouraging piece that we can do.
Yeah, I've heard over the years so much in terms of people's questions about what you just said, Zach, of like, if you feel fatigued, the natural response is to move less, right? When in fact, you're recommending people move and have some physical activity, and that could be helpful for fatigue.
Yes, it's that double-edged sword of
Yeah.
I'm tired, I don't want to move, but
Hmm.
really, if you look at the research compared to pharmaceuticals, compared to even some psychological therapies, exercise really is the number one thing that helps fatigue. It's about approaching it cautiously and mindfully, much like Dr. Fisher was saying, but a lot of it really is starting slow and starting kind of low with what you can currently tolerate and moving from there. But really, exercise is the number one and best thing that helps us with fatigue.
Hmm. Yeah, that's certainly a meaningful impact of exercise and physical activity is things like impact on fatigue. Also, as you briefly mentioned, depression or anxiety and things that people might, some of those emotional responses that they might be experiencing, that physical activity also has really been proven to help with that. Um, in addition to that, what are other meaningful impacts of exercise and how it pertains to cancer treatment and particular symptoms people may be experiencing or side effects?
Yeah, so as a physical therapist, I'm pretty biased, and I am privileged to work with folks really along the entire trajectory of cancer, whether it's treatment or even prior to even diagnosis, during treatment, and even thereafter. Because of that, I get to work with a lot of folks who have different barriers to movement, whether it's pain from surgery, whether it is fatigue, whether it's pre-existing injuries or pre-existing um, yeah, hindrances to being able to move. So the number one benefit that I get to appreciate every day is really just the impact on our overall physical function, whether it's strength, range of motion, our ability to engage in all of the activities that are meaningful to us. Exercise really is foundational for that. I think beyond that, we talked about depression, anxiety, low to moderate exercise tends to have really incredible benefits from or impacts on those specific scores and outcomes. Specific to cancer and cancer treatments, exercise is incredibly helpful from an immune system perspective, from regulating our appetite, from improving sleep, from helping our brain function better in a very similar vein as mindfulness. And
Mhm.
so all movement is good movement. And I think you can look across the span of research and find a ton of benefits that can impact you where you are today.
That's great. And people might be thinking sort of like, well, how do I start? You know, like what can I do to start thinking about being more physically active, what that might be in my life? What are two or three strategies that people could implement today, starting today for themselves?
Yeah, the first one I would say it was just leverage your village. So whether it's your friends, your community, your neighbors, whether it's a walking buddy, having somebody who's going to call you regularly, which could be a time where you just stand up and walk around. There's a ton of folks probably around the spectrum in your different spheres of influence who would be willing to be an accountability buddy or just a friend to engage with you in some different activities. So whether it's going to a park or, like I said, talking on the phone. Leverage your village is one. The second piece I would say would be just leverage technology. Our smartphones or our fancy watches that many folks have a ton of just options that help to actually track and to measure what you're doing from a movement perspective. It's difficult to improve what you don't measure. And so sometimes just looking at your step counts or just looking at what your sleep may be or how many activity points you have, I think can be a really fun way to gamify exercise and to make it a little more fun to engage. And the last thing I would just say, this is probably the most simple piece, is just sit less and move more. It could be just kind of bouncing your legs up and down or pumping your ankles if getting up from a chair is a little bit more cumbersome and difficult for you. Or it could be engaging in more extremes of activity, recreational things over the weekend. Really sitting less, moving more, leveraging technology, leveraging the people around you really are the best ways to make it something that's sustainable both now and past treatment.
That's really great. Very helpful. And for folks where they might feel like they have sort of a um, uh, even knowing some of those things that tapping into the motivation to do them and to take that first step. Can you share how you and your team help people with that motivation to engage in those activities? Because there's one thing your brain telling you, you know, I need to do it. Then there's the other, like to get yourself to do it. How do you and the team help people work through that motivation piece?
Yeah, I really think anybody in this space, we don't need more doctors, we need more champions and advocates. And really, that's how I perceive myself as a physical therapist. And Keegan mentioned this in her and her talk as well, just about the importance of getting to know our patients and the people we serve and where they are. Cancer doesn't happen in a vacuum, and you bring your entire self and your entire story to that. And so, what myself and my team of physical therapists and occupational therapists at Duke do is really get to know you, what you enjoy doing, what you're hopeful to get back to, what are some barriers that prevent that, and then we work together to make some strategies to start to move the ball forward on your specific goals. We have PTs integrated in the cancer center. There's exercise physiologists who help do exercise consultations, but really there's a whole team surrounding you here at the cancer center that really are prioritizing you and your health and what your goals are as it relates to exercise and physical activity.
Thank you, Zach, so much. Um, Julianne, I want to talk with you for a moment and as I think about my question for you, I'm going to sort of share my question and then if you could introduce yourself and your area of expertise. But we've talked a lot about sort of changes in people's body they may experience and their self-image that also extends then to sexual health and taking time to understand and care for these changes that people are experiencing to support themselves, their relationships, and their overall quality of life. And these are topics, though, that people might not be sure if they can or should address them with the care team. Um, could you introduce yourself and your area of expertise and talk about the work that you do?
Yes, I'd be happy to. Good afternoon, everyone. My name is Julie Installs. I am a clinical health psychologist, and I conduct research and provide clinical care to support patients to manage both sexual and reproductive health changes that are really commonly experienced during and after cancer. And yes, I agree with you, Cheyenne, that these changes, with regard to sexual health, body image, intimacy, are all really important parts of quality of life for many cancer survivors. And changes in these domains can cause distress, just as changes in other important life domains as a result of cancer can cause distress. Um, and these changes are really common for many survivors, both during and after cancer treatment, and really can occur in a wide range of domains. So we often hear survivors describe things like changes in sexual interest or desire. So maybe they're not feeling as motivated to connect with their partner intimately. They may also experience things like changes in their ability to develop or sustain sexual arousal. They've shared with us often as well that they might have changes in how satisfying sexual activity is to them. And this can be associated with things like their how they view their body or their confidence and how their body looks, which really can shift for a number of people during and after treatment. And other really common things that we hear in this domain are changes with regard to experience of sexual pain. And each of these that I've described are just samples of changes that can occur that can affect folks individually and in their relationships.
Mhm. And this is something that's important for people to think about um, after they complete treatment, but also during treatment, right?
Yeah, absolutely. All of those examples that I just shared can be things that patients might experience during treatment or months to years after treatment has been completed.
Mhm.
Mhm.
And within the team that you work, can you share a little bit about sort of the multidisciplinary approach that we take within the team to help address those different areas of concern that you mentioned as it relates to sexual health and intimacy?
Yeah, absolutely. It is not uncommon that addressing sexual health and intimacy concerns does take a team approach. And this is because these concerns really can be driven by physical changes, social changes, so like changes in relationships that happen during and after cancer treatment, as well as emotional factors. So how someone is feeling emotionally in terms of their experience of anxiety, for example. All of these things can really drive people's experience of change with sexual health and intimacy. So, this really requires often a multidisciplinary approach to addressing these concerns. And we are really fortunate here at Duke to have a multidisciplinary team that helps to take care of these concerns for patients. One example of this is we have a really fantastic women's sexual health clinic that is multidisciplinary in nature. And we are really working toward having a parallel male sexual health clinic as well. So that program is in development currently. But what this program entails is really, um, collaboration between medical providers, advanced practice providers, our wonderful PT team, as well as psychosocial team members to really work together to address patient sexual health concerns.
Yeah, and I think that speaks to what you were saying in terms of the complexity of the impact of specific treatments on sexual health, and that could be physical changes, it could be emotional changes, it could be the treatments themselves, or it could be the fatigue Zach was talking about, or other sort of ripple effect impact that they may be experiencing. And so the team works together to help. Again, I think the theme we're hearing about today is really that personalized approach for what is the impact that they're experiencing and who on the team can help and how. Is that your experience with the team?
Absolutely. Yeah. I think there can be a variety of symptoms outside of sexual health concerns, like those that have been mentioned, fatigue, pain, in other areas of the body as well, that can really drive
Hmm.
this experience of challenge. And so we really try to work together to help come at this from a number of angles to support patients to improve those domains.
One role that people might not be as familiar about in terms of this, certainly in terms of their provider and the physical side effects of treatment or medications that they're on, or the emotional side. Zach, I think people might not be as familiar with the role of a physical therapist
Mhm.
in a sexual health clinic. Can you share a little bit about the role of that your team plays?
Yes, our physical therapists, many of them are, actually all of them are oncology certified specialists as well as women's health specialists, or even myself being male pelvic health specialist. And so really there is a wealth of resources available. From a PT perspective, we really are movement experts. So anything that precludes, hinders, or slows movement. So whether that's muscle tensions that may be leading to pain with penetration or arousal or orgasm, whether it's strategies to manage erectile dysfunction, education on lubrication, if that is a concern, and then even adaptive strategies to help, whether it's positioning or bolstering or things just to make um, relational intimacy more comfortable and yeah. So really, mobility, strength, pain, all of the same things that we tend to think about when we think about PT, but just applying it in a little bit of a different realm.
Right. Yeah, that's amazing. Thank you, Dr. Stells and Dr. Talley. Felicia, you play a big role in this clinic as well. I'd love you to share a little bit more about the work that you do as a family therapist, and then how that also relates to the sexual health team as well.
As a medical family therapist, I really like to focus on helping patients navigate the emotional and psychosocial impact of cancer, not only on them, but their family system. And when it comes to my involvement in the sexual health clinic, it may start out individually, where we're focusing on the adjustments that a patient may have to make to medications and treatment, but also how they see themselves and some discussions around their body image. But where we would bring in family in the relational context is partners in their relationship. So a lot of times I am also providing psychotherapy for couples and how to communicate with concerns and changes that have been made not only physically, but mentally and emotionally. What does this look like for me and the experience that I have encountered with treatment? But also, how can I understand my partner's or in spouse's response to those changes that have been made?
Mhm. Yeah, I think it really having the expertise to help with those relational components and the communication is really important. And I know I passed over this really quickly, but if you could spend just another moment, Felicia, sharing, people might be familiar with therapists or counselors. Can you share just a little bit more about your specialty as a medical family therapist and what does that mean in terms of your work here at Duke?
Yeah, as a medical family therapist, like Cheyenne said, people may hear a lot about psychotherapy, and so the area that you would focus on in talking about how life stressors may impact you, any transitions that you experience, but specifically to cancer, this is something that impacts not only the individual but the family system, and so our role is to help patients navigate those difficult conversations, understand the emotional impact, but not only for themselves and their family, but across the medical system, navigating those conversations of questions that you may have in being an advocate for your care. What that needs to look like involving other providers, not only in the oncology space, but our wonderful survivorship team, right? So I may refer someone to the sexual health clinic or to PT or even our child life specialist if we have a family with small children.
Mhm. What, extending that question a little bit, what types
Mhm.
of changes do you commonly see in relationships, whether that's partner relationships or family relationships during and after cancer?
Um, During cancer, well, from the start, cancer is something that disrupts the family system, right? This isn't something that we seek out. It happens beyond our control that this has happened. And so families will transition in having a tough time transition and really understanding what that means. And so that could be role changes. And I have gone now from spouse and partner to caregiver and patient, right? I am navigating being a mother and a wife, right? Or even individuals who are single, there's an adjustment in what support needs to look like for them. So there's difficult conversations around who do I reach out to during this time? And so it's important for us to, in the therapy space, to help patients identify what support needs to look like for them, and how to communicate those needs in the context of providing those loved ones with some education around what they're experiencing, but also what may be appropriate at that time too. Because we know that cancer is something that's it doesn't look the same for everyone, right? So it's important for you to say, this is what I need today. It's an emotional roller coaster. That's how I like to refer to it a lot of times to my patients. And so what you may need at the start of treatment looks completely different in that transition into post-care.
Mhm. And I think if it's sort of similarly, like we were talking about with Dr. Talley, Dr. Fisher, in terms of sort of the muscles, right? There's like your
Mhm.
actual muscles and movements, and then sort of the practice around building the skills around mindfulness. It's similar in terms of the work that you're doing, in terms of people tapping into certain strengths that they might forget that they had, or how to apply their strengths into this scenario and facing cancer and the changes they're experiencing, and almost sort of practicing communicating differently or the changes that they're trying to make in their life. How does that play out in terms of your work with them as a therapist? Like, what does that sort of look like in terms of therapy or support groups?
Um, in the therapy space, it's really trying to help normalize what the person is going through. And by that, I'm meaning really helping them identify their emotions and give it meaning, right? And so, if we're able to help the individual understand that, then they can then express to their family and loved ones exactly what they're needing. A lot of times at that point, we are bringing in others. So our support services, well, in the therapy space, it's not just for individuals, especially in medical family therapy. We think in the lens of a systemic context. And so we want to bring in as many people as we can to help them understand what you're experiencing, but also giving you that team and support because it does go beyond the medical space. When you leave our offices, when you leave out of an appointment, you have to go home and continue living, right? And so we want to make sure that those around you are also able to help you do that and navigate it.
Wonderful. Thank you, Felicia.
Mhm.
Um, You work a lot with families in your work, and you often collaborate here with your team member, Mika Sidios, on the call. Mika, can you share with us a little bit about your role as a child adolescent life specialist, especially working with adults facing cancer?
Yeah, good afternoon. So my name is Mika. I'm a child and adolescent life specialist, and like Cheyenne mentioned, I work with adults in this specific arena with in oncology who have kids in their lives. And I often will work alongside Felicia when there is a family or an adult who has a kid in their life who they want help navigating either conversations with their child or teen, or just want to provide a space for their child or teen to be able to ask questions to make sense of what cancer is and isn't. So I come alongside families, often parents, in just providing language, helping gather ideas of language that they could help in conversation with their telling their child either new diagnoses or anywhere along the spectrum when it comes to either end of life or even in finishing treatment. One of the questions I get is like, how do we tell our child or teen that treatment is ending? And do we tell them that, like, hey, this isn't going to happen again? And I always encourage not to make promises because you
Hmm.
never know what the future is going to hold. So I always say, like, hey, let's celebrate the moment now that treatment is done, and just you let them know this is what we know now.
Hmm.
And that's often the conversation I'm having with parents is tell having them tell their child or teen, hey, this is what I know now.
Hmm.
Um, and that brings up a conversation I often have with kids and teens, with parents present, of the hearing the words "I don't know."
Hmm.
Those words can be very frustrating for kids to hear when a parent responds with the answer "I don't know."
Hmm.
But I like to talk about those words and what they mean for their parents as well. When the doctor says, we don't know how long this is going to take, and just what that means in the world of cancer in general,
Hmm.
and that the family and the kids can still be frustrated and disappointed. And what do we do with that? And how do we make sense of that? So we talk about those words and what that means in this space, and that it's okay to have feelings attached to them, but um, we
Hmm.
still won't know. And this is what we do know. So we talk about the things that we do know, and oftentimes it is, what is cancer? What is it? What is it not? This is what they can expect as their parents go through treatment. Um, and parents will often tell, well, do I need to tell my kids or teens that I have this diagnosis? And I often say, well, kids' superhero power is observation of the adult loved ones in their lives. They
Right.
pick up your stress. They like to watch you. They like to hear things, and they are hearing and watching when you don't really know that they are. And so they might hear something that you don't realize they heard. So they're going to go fill in a blank
Hmm.
somewhere, right? And so you want to be the ones to put answers in those blanks for them, and not have somebody else do that. And so let's let me help you gather ideas to how to do that that makes sense for you and your family.
Hmm.
So just coming alongside parents and helping gather language to do that, and also providing a space for the family to meet, to have those honest conversations, and to provide space for kids to understand at their developmental level.
Yeah, those are all great points, and it's something that I know Felicia can attest to in her work is those are some of the first questions either parents or grandparents have is how do I tell my kid or my grandkid about my diagnosis or a change that they might see in my
Mhm,
stress or in
mhm,
some physical changes I might be experiencing as a result of my diagnosis. And as a parent, those are hard conversations to have. And some people might already have the skills and abilities to do that and have these open, honest conversations. But for a lot of people, in fact, probably most parents, it's like, how do I find those words? What are the right words? What is
Mhm.
truly, when you say developmentally appropriate, like how do you have that conversation with a 4-year-old whose grandparent was just diagnosed versus a 12-year-old or a 16-year-old? And from what you're describing, those are conversations that you have with families, with parents to help them um, learn or tap into how to do that. And then also
Mhm.
similarly, it sounds like the kids to be able to ask their questions, right?
Mhm. Yeah, so getting to learn, kind of like what everyone has said before,
Hmm.
getting a chance to learn not only about the patient, but I get a unique chance to learn about the kids in their lives and really how the kids see the adult loved ones in their life, especially
Mhm.
the patient, and how they're seeing this shift of how cancer impacts them. Oftentimes, I hear kids say, this is hard for me too.
Hmm.
And when I get to a chance to validate kids, like, yes, this is what I hear kids say all the time. They're like, oh, I'm not the only one.
Yeah.
Like, and like, yeah, and to normalize that for kids, that's what they want to hear. And to hear parents, to see parents like, oh, other kids have this experience too. Like, yeah, they do. So it's a lot of normalizing some of the hard that takes place because of cancer in kids' lives. Developmentally, getting to look at, like, let's say a 4-year-old, and what makes sense to a 4-year-old is going to look different than what makes sense to a 16-year-old, and
Hmm.
what language we use, and um, are we going to use more tactile maybe Legos or bubbles with a 4-year-old versus like, hey, let's draw this out. Let's look at a microscope. Let's talk through this and be more conversational about this with a teen.
Hmm.
So those are some a quick difference on developmentally, but virtually not meeting with the 4-year-old because that's just hard. But
Right.
sometimes 16-year-olds are way more like, hey, let's meet virtually, and that's a bit more appropriate. So, but yeah, just providing that space for kids to be
Hmm.
able to come in and ask their questions and understand and be validated in
Yeah.
their experience in this too.
I think about something Zach said when he was talking about fatigue. That's like, the one side of the coin is you feel fatigued, don't move. The flip side of that coin is you feel fatigued, movement is helpful, right? And so for
Mhm.
parents and kiddos, when in relation to these conversations, sometimes the instinct is this is a tough conversation. I want to protect my kid, therefore I'm not going to have the conversation. But the flip side to that coin is having those tough conversations can actually be very helpful for families. Can you
Yeah.
share a little bit about that and how you frame that for folks when you meet with them?
Yeah, I like to just share that like it's kids are afraid of what they don't know. And
Mhm.
so as kids are observing their parents and hearing things like what we don't know, like we can create a lot of scary things in our heads, especially as kids. Like the imagination can be very wild. And then you try to go figure out things, ask your friends at school. And so things are a lot more scary than if we don't know about them.
Mhm.
Even for adults, right? When we don't know things, we're like, oh my gosh, like the anticipation and the stress, like it's just a lot. So I help kind of connect that with parents. And I also help them understand that this is might be one of the harder conversations they have with their kid, but that's not the last hard conversation. So how do we learn to have hard conversations with your ch child. And
Mhm.
I would love to just walk alongside you and help maybe give give you some language or ideas of language. How can I help you navigate this conversation so it doesn't maybe can take the edge off of the hard this
Mhm.
time, so that way it can help for further hard conversations that are to come,
Right.
because it's not going to be the last one.
Yeah.
And by having this hard conversation, it really just builds trust for the child to come and ask those hard questions as they
Mhm.
start to experience or see hard things because of the cancer.
Mhm.
So,
Yeah, absolutely. Thank you so much. And I
yeah.
think today's panel is so helpful to sort of normalize exactly, I forget who said it, but sort of normalize the different things that people may be experiencing or they may be questioning or they may have concerns about, that those are things that are absolutely normal, and why we have this incredible team here to help support them with the different ways that cancer might be affecting their life or their relationships or these different things. So it's again, I always think about, it's hard to know to ask for something if you don't know it exists. So a panel like this is really helpful to know, like, oh wow, a PT does that, Zach. Like, hey, I can actually reach out and maybe meet with the team and share some of the questions that I have. And I think that knowledge and sharing of the information, sharing of the resources is really helpful. And I appreciate all of you sharing that today. And I have a few more questions for the group, and we've had some questions come through that we've sort of woven into the discussion today. But anybody on the webinar who does have additional questions that they want to ask our panelists, please continue to put those in the Q&A feature within the webinar. You should see that at the bottom of your screen, and we'll continue to address and answer some of those questions as they come through. We have about 10 or so more minutes, and so I'd like to also sort of go around a little bit with our panelists. And based on the discussion today, what is sort of one additional thing or one thing you want to sort of highlight that you feel can make the biggest difference for people in terms of something they can do or adopt into their life that can make a big difference for them from your area of specialty, for these patients or survivors to incorporate into their lives going forward? I'll start with Dr. Fisher.
I had a feeling you were going to start with me.
I started with you at the beginning, so I thought I'd go back.
No problem. Yeah. So, one thing that I find useful myself and that I encourage my patients to consider in my clinical work with them with respect to mindfulness is to use coping statements. So these are maybe short sentences or mantras that are relevant to you and resonate with you, that might tie in to some of the key principles of mindfulness. So things like acceptance, letting go, patience, non-striving, so trying not to force things to be different. So some examples of coping statements I use myself include, I have them written down at my desk actually. So it's like this right now. So again, just sort of a short statement that reminds you, hey, this is what's happening in the current moment. Things change and will be different in the future. Make incremental progress, not perfection. Slow and steady, focus on the next right thing. So often when going through a big stressor, for example, a cancer diagnosis and treatment, it's easy to get caught up in sort of the planning and what's next, what's the next step. And before you know it, you may have sort of been carried in your mind to a pretty dark and scary place. So can we instead remain current, remain present, and just focus on what is the very next right step? So these coping statements can be written down. You could put them in a notes app on your phone. Some people like to put them on t-shirts. I mean, you can get really creative, but I encourage you to maybe pop them up around your space, your bathroom mirror, your kitchen, your car, places where you go a lot. And you get that frequent reminder that just to sort of to anchor back to the present moment.
Thank you. That's great advice. Dr. Stulls? Oh, Dr. Talley, go. I went out of order there for a second. Sorry.
Um, two quick points. One resource. There's a great organization that has put together a wealth of information related to exercise and movement. If you search "exercise is medicine, moving through cancer," there are a lot of patient-friendly resources, general exercise guidelines, general just information that can be really useful for you as you look into what does it look like to move a little bit more. Um, and so I think that would be the first one that I would point you to. The second, I guess, kind of habit or support maybe would just be to tell somebody. I think it's very easy to go through this entire process and this entire experience and for it to be very isolating. And particularly when you're thinking about trying to do something new or trying to start a new habit or pursue a new goal. One of the most important things that determines your overall success is just your ability to have another person beside you as you're going through it. And so sharing somebody your exercise goal or your struggles with movement, whether it's your physical therapist at the cancer center, shameless plug, or whether it's your primary provider or just somebody who has an important place in your life, that can make a really big difference in helping you to actually move the ball forward.
Wonderful. Thank you so much. Dr. Stahls?
Yeah, I think one of the main things that I'm often working with patients to kind of grapple with is really this idea that intimacy is much broader than sexual activity alone. And yet we find that when people are experiencing challenges with sexual activity during and after cancer treatment, it might mean also that this kind of expands into other areas of intimacy for them. So to think of intimacy broadly, this can look like holding hands with your partner, sitting down and having a conversation with no devices on, which is tough for a lot of us these days. Um, you know, holding, like I said, holding hands, just really spending time together. So, stepping back, and just thinking about intimacy broadly can really help to find ways to connect with your partner during and after treatment, even if, sexual activity is an area of challenge.
Wonderful. That's great advice. Thank you. Felicia?
I really want patients to understand that in this space in our team that we know this isn't easy for you. And so making sure you're always validating those feelings, the difficult feelings and emotions that come up to normalize the experience for you. And lean into those supports. I know cancer is something that can be extremely isolating, but it doesn't have to happen in isolation. So those who may not have family members or friends or, a social support system, we have support groups for that. And so I also encourage to get involved in our breast and GYN oncology support group. That's one that I facilitate, but it's also an area to connect with women who have that shared experience. Yes, it looks different for everyone, but it's a good way to come in and connect with others. There's also our general cancer support group. I'm pretty sure Christy can throw in some links into the chat for you all, but give yourself grace in navigating all of this. Still take it one day at a time, but know that there is support out there for you to get through it.
Thank you.
You're welcome.
Mika?
Yeah, I would say that you know your child the best. And one of the things that I know many patients come in and right at diagnosis, I hear this a lot, is the first people they think of is their kids and how they're going to tell them. And it it just I think so many, and you're not alone in that. And our parenting with cancer support group, I know so many of the other support groups have been mentioned, has been a great group for parents to connect with other parents and hear how did they do it. And to ask questions and to once again feel not so alone in the space of parenting with cancer. So great group. And yeah, just that it is a common and normal thing to have your kid right there on the front of your mind when you're diagnosed, and not for them to be at the forefront throughout and how they're doing. So, and we're here to come alongside you.
Perfect. Thank you. And Keegan?
Yeah, Yeah, so kind of in this setting, a lot of people get so excited about nutrition and want to make like big changes really quickly, take everything out of the pantry and throw it all out and do a big grocery haul. And I really just would love to just pump the brakes just for a second. Really slow and steady wins the race in this. Small changes. I recommend starting with either the snacks or starting with one meal or one day a week. Take that time to connect with your partner, with your family, with your friends, make a very intentional meal and start that way. Once it gets easier, capitalizing it and adding to that as well. I really want to hit the 80-20 rule. 80% success throughout the week, 80% adherence, consistency in that is perfect. 20% enjoy.
Nice. I love it. Um, well, you all have shared such really important information for people. And there's definitely been some common themes that have run through our discussion today. And as we are um, approaching the end of the webinar, I just wanted to sort of circle back to a couple of those themes. And if anybody has anything to add, please feel free to. I think one of the things that we saw in the questions that came through and through what you all have shared is that a cancer diagnosis, whether that's during treatment or in survivorship, does not equal the same path for each person. And what you have each shared is the importance of personalizing the care we're providing for patients. And what that also means is we all, as care team members, alongside the folks that are sort of traditionally seen as the cancer care team, the oncologists and others, that you all represent a broader group of team members who have expertise and talents and ability to connect with people on additional things that they have questions about, concerns about, that you can really take that moment to personalize your care and to hear how you all do that so exceptionally well to really understand the unique needs of the person that you're talking to, the person or their family, and how you can help address those concerns with your own set of expertise, and also how you talked about sharing the work that the broader team is doing. So, Felicia working with Julianne and Keegan, all working together to sort of help patients, is something that I think people, if they don't know this about their cancer care team, your cancer care team is a deep bench. It involves a lot of different people with a lot of different expertise that are really here to help support through all those different needs that you may face. And so those themes of please share with your providers your questions that you have. So we had some questions today that we weren't able to get to. Those are things that you can share with your team members, share with your oncologist, or directly reach out to our team, and we'll share how to do that in just a moment. But bring forward those questions, bring forward those concerns, because we have people who can help support you with those needs here at our cancer center, or if you are attending this webinar and you are on UC Care at another cancer center, you should expect the same level of care wherever you go in terms of taking that personalized approach to your care and connecting you with resources either internally to your cancer center or external resources, including some that were shared today. So I think in addition to that, this theme of a community of support for patients to also build their own bench, that includes their care team. It's also who is around them to help to be able to share their experiences, to be able to share in building these skills and tools to help them cope with the changes or challenges that they may be facing in survivorship or during treatment, that there is a community here to help support one another as patients, but also with our team of expert clinicians, as well as the other broader members of our oncology team. And so I appreciate all of your time today, folks on the panel. And for those attending the webinar, we also have a list of resources that you will be able to access yourself to learn more about all the services that we mentioned today and more. You'll find those resources at dukehealth.org/cancer support. We will also have that information here on the screen for you to be able to follow up with our team to get more information and connect with resources that we've shared today, whether that's individual clinicians or things like support groups that we offer and other resources that our team has available. So I appreciate everyone's time today on our panel, as well as those attending, and I look forward to seeing everybody the next time.